1. Which key principle of adult learning ensures that learners apply coding guidelines to real-world patient scenarios? A. Experiential relevance. B. Passive absorption. Memorization of policies. Task repetition. 2. When developing a coding curriculum, what is the best way to ensure that learning outcomes align with Codebusters' test objectives? A. Focus solely on lecture content. B. Map each objective to evaluation criteria. C. Limit testing to multiple choice items. D. Use outdated coding case studies. 3. Which method most effectively evaluates a learner's coding accuracy for ICD-10 CM diagnosis coding? A. Peer feedback discussions. B. Scenario-based coding assessments. C. Group brainstorming sessions. D. General knowledge quizzes. 4. In mentoring new coders, what strategy supports independent decision-making during the coding process? A. Provide immediate answers to all questions. B. Encourage use of coding references and rationales. C. Assign repetitive coding drills. D. Restrict feedback until test completion. 5. What instructional technique best supports adult learners preparing for the Codebusters test? A. Rote memorization of codes. B. Active problem solving in authentic coding cases. C. Daily code transcription exercises. D. Passive video watching. 6. What communication method is most effective for clarifying coding discrepancies in a classroom? A. Publicly correcting errors. B. Using non-judgmental evidence-based feedback. C. Ignoring minor mistakes. D. Allowing peers to debate until consensus. 7. When assessing procedural coding accuracy, which evaluation method is most reliable? A. Coding performance audit using CPT scenarios. B. Group opinion surveys. C. Attendance tracking. D. Self-reported learning logs. 8. In the context of regulatory compliance, what should a coding instructor emphasize most? A. Following official coding guidelines and payer rules. B. Using personal judgment when coding. C. Ignoring ambiguous documentation. D. Prioritizing speed over accuracy. 9. When providing feedback to adult learners, the mentor should A. Focus on both strengths and improvement areas. B. Correct errors without explanation. C. Delay all feedback until course end. D. Avoid discussing performance. 10. Which teaching strategy promotes learner engagement in coding case reviews? A. Interactive group coding sessions. B. Solely instructor-led lectures. C. Individual memorization quizzes. D. Passive note-taking. 11. What is the best way to evaluate competency in ICD-10 PCS coding? A. Performance-based practical coding exercises. B. Written essay on procedure terminology. C. Group discussions. D. Oral recitation of definitions. 12. To maintain compliance, instructors should ensure learners understand A. Coding ethics and documentation standards. Only the most common diagnosis codes. C. Personal shortcuts to speed coding. D. Simplified coding without verification. 13. What mentoring approach builds confidence in coding application? A. Guided practice with increasing complexity. B. Memorizing code tables without context. C. Observing peers without participation. D. Repeating the same basic exercises. 14. Which component of curriculum design best supports adult learning in coding? A. Integration of real-world case studies. B. Daily code memorization drills. C. Focus solely on test content recall. D. Random topic sequencing. 15. When instructing learners on DRG assignment, the educator should emphasize A. The relationship between diagnosis, procedures, and reimbursement. B. Only the most frequent DRG codes. C. Ignoring sequencing guidelines. D. Estimating reimbursement values. 16. In coding education, which evaluation technique measures applied knowledge? A. Coding chart audits. B. Multiple choice recall quizzes. C. Group icebreakers. D. Attendance logs. 17. During mentoring, what is the most effective way to address repeated coding errors? A. Review root causes and demonstrate proper application. B. Reprimand publicly to ensure compliance. C. Ignore errors to maintain morale. D. Provide unrelated practice exercises. 18. What adult learning strategy increases long-term retention of coding guidelines? A. Repeated application through simulated patient cases. B. Memorizing full ICD-10 manuals. C. Skipping exercises once reviewed. D. Reading rules without context. 19. Which principle of effective communication enhances peer collaboration in coding teams? A. Active listening and constructive dialogue. B. Rapid instruction without feedback. C. Speaking only through supervisors. D. Avoiding all peer discussions. 20. What is the most appropriate instructional method for teaching CPT modifiers? A. Case-based coding examples demonstrating modifier impact. B. Reading modifier definitions aloud. C. Watching recorded lectures. D. Memorizing modifier numbers. 21. When creating evaluation rubrics for coding tests, instructors should A. Align criteria with learning outcomes and coding standards. B. Use general scoring categories only. C. Focus on attendance and participation. D. Evaluate based on student opinions. 22. To ensure compliance with HIPAA, coding students must understand A. Protection of patient identifiers in all documentation. B. How to share records for group learning. C. That HIPAA does not apply to coding exercises. D. Only instructors are responsible for privacy. 23. What is the most important skill for coders when interpreting provider documentation? A. Critical reading and clinical reasoning. B. Memorization of code descriptions. C. Ignoring unclear details. D. Guessing missing information. 24. Which method best evaluates learners' coding speed and accuracy balance? A. Timed scenario-based coding tasks. B. Group case presentations. C. Written essays on coding ethics. D. Oral tests on code structure. 25. During mentoring sessions, constructive feedback should be A. Specific, timely, and actionable. B. Delayed until test completion. C. General and non-detailed. D. Focused only on errors. 26. When teaching coding compliance, instructors should highlight A. The consequences of fraudulent coding practices. B. The fastest method to assign codes. C. How to avoid documentation altogether. D. The personal preferences of auditors. 27. Which adult learning approach motivates Codebusters test candidates? A. Relating content to professional practice outcomes. B. Requiring rote memorization of every code. C. Ignoring learners' prior experiences. D. Limiting discussion of case rationale. 28. What evaluation method ensures fairness across multiple coding instructors? A. Standardized scoring rubrics and calibration. B. Subjective instructor opinion. C. Peer group averaging. D. Self-assessment only. 29. What is the first step in curriculum development for coding instruction? A. Conducting a needs analysis of learner and industry requirements. B. Writing random learning objectives. C. Scheduling test dates first. D. Selecting textbooks before objectives. Instructors can best foster professional ethics in coding by A. Modeling integrity and transparency in case discussions. B. Ignoring minor rule violations. C. Encouraging shortcuts for efficiency. D. Focusing only on test content. 31. When correcting documentation errors during instruction, educators should use real but de-identified examples. B. Display identifiable patient data. C. Skip examples to save time. D. Share previous learners' mistakes publicly. 32. Which communication strategy builds trust between mentor and learner? A. Encouraging open, respectful dialogue. B. Providing limited communication. C. Using only written instructions. D. Withholding feedback. In coding case simulations, realism enhances learning by A. Strengthening critical application of coding rules. B. Promoting memorization of definitions. C. Eliminating the need for instructor guidance. Simplifying documentation details. 34. What evaluation tool provides detailed insight into learner performance trends? A. Coding competency tracking matrix. B. Anonymous course surveys. C. Random oral questioning. D. Daily attendance sheets. Instructors ensure retention by using A. Repetitive case review and debriefing sessions. B. One-time lectures with no review. C. Self-paced reading only. D. Irregular feedback intervals. 36. When mentoring, how can an educator measure learner progress effectively? A. By comparing pre-assessment and post-assessment results. B. By informal observations only. C. By counting participation. D. By collecting anonymous opinions. 37. Which compliance topic must be reinforced when coding inpatient cases? A. Accurate sequencing of principal diagnosis and procedures. B. Shortcuts to maximize reimbursement. C. Ignoring physician documentation. D. Substituting missing data. 38. What mentoring behavior best demonstrates professional integrity? A. Upholding confidentiality and ethical coding standards. B. Sharing test questions with learners. C. Avoiding discussion of compliance topics. D. Ignoring regulatory updates.